My name is Mark Anderson. I'm one of the physicians, as Judy said, at Executive Medicine, and I want to thank you all for letting us come in and do this program. I'm hearing great feedback already from the staff about everybody's participation and what a good time they're having. So I have a simple question for everybody. Everybody's probably in management here is, how many of you, your job is dependent upon metrics? You have numbers that are coming through or measurements. Raise your hand. All right? What if I took those metrics away from you and said, do your job? You going to be very successful at it? Right. It's the same thing with your health. And so when we talk about knowing your numbers, we're going to go through all kinds of life things. You can't measure it, you can't manage it. And I'm not an MBA, but that's what my MBA friends have told me they were taught day one, right? So we all need the management. And we can't fix what we can't measure. And so one of the things that we talk about at Executive Medicine is expanding that breadth of numbers that you can have for assessment of your health. So some simple numbers that everybody has access to. You've got a nurse's station down there that's got a vitals machine in it. It does your percent body fat. It'll do your blood pressure. You can do height, weight, circumference measurements with simple things. And those are pretty easily obtained, and we can all keep track of those. Waist size is important just as a predictor. The other is lab work. So you need to get some labs checked. And we'll go into the labs and other things that we want to do. Just some big stats, talking about every 25 seconds there's a heart attack, and every minute somebody dies of heart disease. So a lot of people with coronary vascular disease throughout. 33.5% of adults 20 years of age or older, hypertension, and the number's going up because we got a generation coming behind us that's got an epidemic called obesity, and the hypertension is part of that. And as you can see, about every year in 2010, 2 million people were diagnosed, new diagnosis of diabetes, and that's just going to keep going up. So we all have to do our part, and every time we do it, we also tend to help those around us in the community. So some diabetes risk numbers to know. Hemoglobin A1C. A hemoglobin A1C is a simple blood test. You can actually buy the kits to do it at the pharmacies, but you can get it done on your lab work that tells one what their average blood sugar has been for the previous 60 days. So even if your blood sugar is normal, it's important to see if you're getting those glucose spikes, because when you spike your glucose up, your body produces insulin, brings the blood sugar down. Technically, you're not diabetic because you don't have elevated blood sugar, but every time that glucose goes up and that insulin spike, it's inflammatory. And the thing we want to fight is inflammation. Every cellular process in our body results in inflammation, and we don't need to be adding more on there. So when you keep those sugar spikes, and that's where they're talking about eating protein and things that they've gone through with the nutrition, you're keeping that down. Body mass index, or BMI. This is a very simple one. All you need is your height and your weight, and there's calculators for BMI that you can go on the internet and get or download. A pretty simple calculation. They define the BMI as being normal between 18.5 and 25. 25 to 30 is the overweight category. 30 to 35 is the obese category, and 35 or greater is morbidly obese. In 1998, obese was defined as 32.5, and you said, why'd it go down? Americans got bigger. Basically, the more we sit, the more sedentary lifestyle, they had to lower the BMI. And what that represents is the risk for premature mortality between 25 and 30 goes up linear. And the mathematicians, statisticians showed us that when it hit 30 now, it changes from a linear increase to an exponential increase. So there's something about that magic point when our BMI gets above 30 right now. There's some exceptions. It's one metric. I always use Herschel Walker. It's 5'10", 245 pounds. His BMI puts him at morbidly obese, but he's got a body fat that's 8%, 6%, one of the lowest around. So, he's a little different because he's carrying that muscle mass. But I'll also tell you, just based on the statistic, he's not going to last as long as Moose Johnson, who dropped his weight to 205 after he finished professional football, and his height 6 foot, and his BMI is right around 26, because that heart has to work harder, kidney has to work harder to support all that muscle mass. So even though it's healthy muscle, thinner is always better, especially for longevity. Waist size, Simple numbers, 40-inch for men, 35-inch for women. I used to tell the medical students and the interns, said, you want to build a practice real fast, go over to the department store and go to the men's department and hang out in the jeans section by the pants where it's 40 inches or greater and just hand out your card, because they're gonna need you. You know? So you keep buying the big boy sizes, you're gonna be in to see me. And 35 inches for women. So again, simple metrics that they've shown and what that addresses is this visceral adiposity. So the fat that occurs inside one's abdomen. So as this distends, that fat in one's abdomen actually functions as part of the endocrine system and puts hormones out that affect our metabolism, which puts you at higher risk for developing diabetes down the road. So that's why that visceral adiposity or the waist size is important. So you could have normal weight, big waist, and you'd still be at higher risk for diabetes. Heart disease, blood pressure, another simple metric that you can get right down the hall, and you can get them for home. So you want it, they keep lowering it, lower is always better. 135/80 is the current recommendation, and you want to bring that down. It's especially more associated with stroke risk than it is with heart disease or heart attack, but it is at both. Lipid levels, when you get your labs checked, usually they just check your cholesterol, total LDL, HDL, and triglycerides. The LDL, which is the bad cholesterol, is a calculated result based on those other three. It's actually not measured. So one thing that you should push for is getting what's called a VApp or an enhanced, there's various names for it, where they actually measure the LDL, so it's measured, not just calculated, and they also tell you whether that LDL particle size is the big fluffy LDL or the small dense stuff. And the difference is the big fluffy stuff, you throw it up against the artery wall, it tends to bounce off. That's a pattern A. And if you get the small dense stuff, you throw it up against that artery wall, it perforates it, and it's the generation of the plaque and progresses on to cardiovascular disease. Heart rate variability, we do with what's called an ANS or autonomic nervous system testing. And so it'll tell you how the autonomic nervous system, being the part of the nervous system that functions autonomically that we don't think about, heart rate, blood pressure, respiratory rate, digestive processes. That's what the ANS measures, but it looks at specifically on how it reacts to the heart. The important part of that, you can also get some of that information when you do a treadmill. So in other words, you do your exercise test, how fast your heart rate and blood pressure come back down to normal afterwards. They can go up fast, go down. So the sympathetic nervous system is the part of our nervous system that is the fight or flight. Heart rate goes up, blood pressure goes up, all normal responses to exercise. Then you stop exercising, and it should be the parasympathetic. It swings back the other way. It slows things down. Nature likes that variability. She likes it to flow back and forth. That's what exercise does for you more than anything else. It enhances that autonomic function, which is going to keep your blood pressure down. Yes, you burn calories when you exercise, but you don't burn enough to make up for one bad behavior at the dinner table. So that's what exercise does more than anything. It also switches over some of those metabolic processes to process foodstuffs in a more favorable fashion. Another blood test, simple one to get, is a cardiac C-reactive protein. CRP is an inflammatory marker. This one's specific to the inflammation that can occur inside lining of the arteries that generates the plaque, or is the genesis of the plaque. So not everybody who has heart attacks, has high cholesterol. There's multiple reasons why people get plaques, not just they smoked and had high cholesterol and diabetes, all those being very common ones. Calcium score is one that can also be obtained fairly easily. And what it is a limited CT scan of the heart, and that's a picture of it down there in the lower right, excuse me. And I know it's hard to see, but what it's looking for is calcified plaque within those coronary arteries. And it's done by a cardiologist, Dr. Agustin is the one who started this. He's still alive and in Florida. And what that looks at is to see if you have calcified plaque. If your score is 0, it doesn't rule out that you may have soft plaque or non-calcified plaque, but it makes it a lot lower risk. If it comes back it's 300, you need to get some additional testing. It's a screening test. So Sanjay Gupta did a show, it shows every once in a while on CNN, so called The Last Heart Attack in America. Went around, interviewed a bunch of cardiologists and everything. He was motivated because his father had his first heart attack at 44. He was 42 at the time. Came up with 4 things that, everybody got checked. We could significantly reduce cardiovascular disease. Calcium score, cardiac C-reactive protein, advanced lipid panel, and also a carotid Doppler. And we do that as part of our annual exam at Southlake, is we do the carotid Doppler, simple ultrasound test, and what you're looking at that is for intimal thickening, or where you see the artery starts to kind of get thick before it progresses onto a plaque. Hormone levels, the 2 things that progress in age, is inflammation, two main things, inflammation and hormone abnormalities. So when we talk sex hormones, we're talking both estrogen and testosterone in both men and women. It's not one sex or the other. And so both should have those checked. Thyroid functions will fade as we age, and so they need to be optimized. And one of the problems we see a lot of is you go and see the doc, for example, the range on your free T3 is 2.5 to 4.1. You come back and it's 2.7, he or she says, you're fine, it's in the normal range. It's never 2.7 when I check it on healthy 25-year-olds. You check it on them, it's 3.4, 3.5, right? So I don't want the thyroid function of a 60-year-old guy that's in the 10th percentile. I don't want the testosterone of a 60-year-old guy that's in the 10th percentile. I want my levels at the 50th percentile for a healthy 25-year-old. So you need to ask those questions and know what know what your numbers are. Even if they're fine, they may be good right now. Know what they are so you can track them over time and come in and you say, man, my testosterone's gone from 800 to 600. Well, that's a 25% reduction over a period of time. You're going to notice that. But technically, it's still in the normal range, and technically, it's still what the endos will recommend as normal for a man, is 550, right? Not for me. That's time to start on something. It's dropping. And that's a normal function of aging, but you can correct that and maintain it at more optimal levels. But it takes some blood work and it takes checking labs. We are living longer for a while. So the average age for men and women roughly is about 79, 79.3 for women. I think it's 73 for men in the United States right now. But the statisticians and the epidemiologists will tell us this is going down. So we made great strides through the 20th century, mostly through public health measures. Clean water made a big difference. Vaccinations, antibiotics, big drop in infant mortality. So you drop down that infant mortality, longevity goes up. But it's starting to crest, and it's going to start dropping here in the next 10 years, mostly due to those 20-year-olds that have hypertension, that are developing diabetes and diseases we didn't see till men and women were in their 50s and 60s. So some of this is take-home message for the family at home, too. And then the question is, great, I made it to 80. What are you doing? You know, are you sitting around at the nursing home and waiting for somebody to come in and wheel you over to the bingo parlor? Or are you out there playing tennis with my dad's tennis partner who's 94, you know, and he plays 2 hours a day, 5 days a week, rides his bike. So big differences, little changes made now can make big differences in how you enjoy it. I always tell the story of Jack LaLanne. Jack LaLanne died at 89. He was sick for about a week, pretty much never saw the inside of a hospital throughout his life. At 82, he swam 2 miles with his hands handcuffed, pulling 70 rowboats behind him. So he's pretty active. Pretty much was a vegan most all of his life before vegan was a term. So he ate clean, you know, he exercised in moderation. He didn't go run marathons or do anything, you know, way out there type stuff, but he did his gymnastics or his exercises and just stayed fit. Lived a very long, healthy life and never spent much time ill. And they'll tell you that's the way our bodies are programmed. That we're just, illness is all a function of our lifestyle for the most part, and other diseases that we can't get. So infectious diseases and such. Exercise 3 times a week for at least 30 minutes. I tell everybody it's easy. Get a sweat up 3 or 4 times a week. Doesn't matter. Exercise counts, you go wash the car. You know, so if you put 2 cars in the backyard and wash them both, trust me, you got exercise. Remember? Wax on, wax off. All right? You want to get all 3 components, flexibility, cardio, and strength training. And that can be various depending on what your activities levels are doing or what you're training for, so to speak. So somebody who's training to play golf is going to be different than somebody who's training to swim or compete in a triathlon and stuff. But you need to make sure you get all 3 everybody, and especially flexibility. And look for the opportunities to get the exercise. You guys got a great facility here, but there's opportunities to get it where you don't have to necessarily come over to the facility. I mean, it's wash the car, it's do the yard work. You know, if you go vacuum the house and you're doing the stairs, like when I do it, I work a sweat up. That counts as some time. Even if you have to break it up, and it's been shown 3 10-minute segments throughout the day, you'll get the same cumulative effect as if it was 30 minutes continuous. You know, so if you got a 10-minute break and you're waiting for somebody, go for a walk, you know, and then come back. Taking the kids to soccer practice and such, you know, walk around the field while they're practicing rather than just standing there on the sideline, and get somebody to go walk with you. You can work that exercise in places where you won't have to find extra time for it. Sleep, very important. Talked about that sympathetic and parasympathetic. right? So we're up during the day, mostly our sympathetic nervous system's in charge. Well, the parasympathetic part wants its fair share, which is what takes place during our sleep phase. So when you're sleeping, that's where a lot of the metabolic processes take place. It's also where blood shunted to the GI tract, digestive processes are taking place. Also the restorative processes in our brain. And that's also where you make muscle. So after you exercise the muscle and you want to keep the muscle up, you need to have adequate sleep. And make sure you're getting good sleep hygiene things. Sleep in a cool, dark room. You can look all that stuff. One of the big deals is avoiding looking at blue light right before you go to bed. So that's the computers and televisions and things like that. Red light helps you fall asleep. The example is sitting around the campfire, a couple s'mores, you're snoozing within 10 minutes, right? That red light tells your brain it's time to go off. It's an evolutionary response. Blue light tells it it's time to get up. That's morning light. Take care of your skin. Women peak with melanoma in their 20s. Men will peak incidence in their 50s. So you want to minimize your sun exposure. A consequence of that is vitamin D deficiencies. So that's where we get back to making sure you're getting adequate amounts of vitamin D. Never go to a tanning bed, increased risk, especially in the young women, and have your skin checked yearly. Be aware of any changes in moles. 1 in 4 Americans dies, or 1 American dies every hour from skin cancer, most of that being melanoma. Squamous cell carcinoma and basal cell carcinoma are not deadly. They can be, but they're not nearly as deadly as melanoma. Balanced diet. Good luck with this. 7 servings fresh fruits and vegetables a day. I go out of my way. I'm lucky to get 4 or 5. I mean, so you got to really seize the opportunity to get that in anytime you can. Nutrition, I tell that mine is clean, lean, and green. So clean, avoid packaged processed foods. Lean is the high protein, low carbohydrate. And the green is get those veggies every opportunity you can, especially the green ones. Avoid the artificial sweeteners, the diet gum, sodas. You ever see a skinny person hold a can of Diet Coke? They're usually holding water. And there's 2 things. One is they're chemicals. The other is when you're taking that in and you taste sweet, you just turned on your gastrointestinal system. It thinks you're eating, okay? And if it thinks you're eating, it's going to try to absorb all those calories. So the next time you come in and get some, it's going to absorb them all and make sure it stores them because it doesn't know whether you're eating or not. You've tricked it. It's not nice to mess with Mother Nature. Obviously, avoid the fried foods, the processed carbohydrates, the white breads. It's the packaged stuff. And you can get better packaged stuff. So if you go get Skinner's spaghetti and it says second ingredient, high fructose corn syrup. But there's spaghetti you can go get that says wheat and water. I understand what that is. That's real spaghetti. Right? So just get better products. So you can still have some of it, but try to minimize it. Stress management. They did this study. Did Dr. Gammon talk to you all about telomeres at all? So they did a study on the telomeres. And what they showed is that they look at various stressors and how they aged people. And the care of a chronically ill child, the stress associated with that, aged that person faster than any other stressors, such as divorce or work-related stress, etc. Second was care of an aged parent. The experience, how many people have had, you haven't seen somebody for a couple of years, you knew that they maybe had a family illness, had to take care of a parent or a child, or they had a personal illness themselves, and you see them and your wife or whoever turns to you and says, good Lord, it looks like she's aged 10 years. She did. She did. Measured. We measured the telomeres on those people who did. That stress of the illness or that stress of that situation in their life aged them much more quickly. So working on stress management is equally as important as the sleep and the exercise. You got to strike that balance or find time for all of them. We did our radio show yesterday, and apparently balance is a bad word, so we're not going to use that with our guests. Lisa Gibbons doesn't like the word balance, so she says you're trying to strive for the impossible thing. Just find what works for you that day, and one day it may be I sat around and did nothing but yoga, and the next day I did exercise or something. But you don't have to feel bad about not having the balance every day, and she's right. Avoid too much caffeine. Never drink energy drinks. Kind of states for yourself. Low caffeine's not bad, but too much of anything is not good for you, including exercise. So, I mean, what I mean by that is you look at the marathoners and these people who do endurance athletes, their risk of cardiovascular death is the same as somebody who leads a sedentary lifestyle. And they don't increase their longevity. They don't live longer. They live the same. So with all those people you see in spandex that are running 15 miles on Sunday morning out of Luke's, you can just say, go right ahead. I'll do my mile and a half, 2 mile, 3 mile walk, and I'll be just fine, and I'm actually doing better than you are. So just that, laughing. So if you don't have anything to laugh about, take your pen and stick it in your mouth and hold it in your mouth because it makes you smile and it actually releases the hormones that will make you have the same effect as if you laugh. And then smile. So smiling and laughing is important for reducing those stress. I think they touched upon some of the supplements. You always want to count these as medications, list them on your medication list when you're visiting with your physician. I have patients all the time, and I'm happy to do it. They bring them in and say, I read about this one, or I got this one for weight loss or whatever. There's a few things that they shouldn't be taking. So if somebody's being treated for blood pressure, you don't want something that has stimulants in it, like the green tea extracts and things like that. Avoid taking too much of certain. So vitamin A has been shown to increase the risk of breast cancer in women when taken mega doses. So I oftentimes will get the older gal will come in and she's taking her multivitamin or calcium with A, and I mean you add it up and she's getting 80,000 units of vitamin A a day. And you say you just need this one. Ocuvite for eye health, macular degeneration. They're taking a multivitamin, and somebody else, ophthalmologist, asked them to take the Ocuvite. Now they got probably too much. Use the supplements to supplement your nutrition, not replace it. And so you want to add to it. Our food chain is compromised, genetic engineering of the produce, and overutilization of the fields. So it has up to 36% less of the nutrients in it that it had just 10, 20 years ago. It's not bad for you, but it does not have the nutrition of that fresh picked tomato out of grandma's backyard. All right? Those tomatoes are picked 2 weeks ago in Mexico. They're green. They hold them up in a warehouse right before they ship them to market. They expose them to xenon. It's an inert gas. Doesn't hurt you, but it turns the skin red, so it makes it look like it's ripe, but you could still knock a hole in the wall with it if you threw it hard enough. So it's not bad for you, but it doesn't have the same nutrition. That's why we need to supplement more today than we ever have. And then we always want to make sure you're taking quality supplements. Big difference between pharmaceutical and the stuff you get at Costco. Some of the healthiest folks around that in my practice have been taking, they're out there, Shackley products, Advocare products, our products. There's others, but you need to do your research, and if you're not sure, ask your doc, and half the time they don't know. They'll say, oh yeah, go take something. Choose your pharmaceutical grade, we talked about that. Everybody likes this one. Men, you want to avoid prostate cancer 3 times a week, 30% reduction. Doctor gave you a prescription, go home and get it filled. It's in the book, chapter 8. It's in the book, chapter 8, so my advice is you dog-ear chapter 8 and leave it open. Lots of studies showing that it makes a difference in longevity. And it's one of those that I get lots of couples come in, and there's some that are still very sexually active, and then there's some that by the time they're 45, 50, because of hormonal issues and health issues, it's just become, we've got 2 twin beds in 2 different rooms, and that's about it. That's not the way you want to live out the rest of your life. So it's also good exercise, does a lot of good things for both men and women, and so important as part of our overall health plan. Finding that step in peace, I think this is where I can double up. When I go exercise, that's my zone out time. So spend a little quiet time, even if it's only 5, 10, 15 minutes. When we've got a book coming out, we interviewed centenarians, and one of the common things in all their top 10 things to do for longevity was forgive. Lucille says she forgives, but she doesn't forget. But she doesn't carry that grudge forward with her. And the other thing is they're all looking forward to the next whatever's coming. Even if it was a matter of laying their clothes out the night before in anticipation of the next day, or if it was in anticipation of the next holiday or the next birthday, they all looked forward. They didn't look back and say, I wish I wish I hadn't done this, that, and the other. So staying on top. 1, get that physical. Add some numbers in there. Get your metrics going. Talk to the doctor about your well-being. Don't let them run in there and say, how you doing? Listen to your heart and turn them out. You got to hold them up or make them make the time for you. Keep a log of the health records. A lot of doctors' offices now using electronic health records. Pretty soon, most of that stuff will move to the cloud type situation where you can retrieve it. And we use a portal so you can come pull down your labs and things like that. But if you can't get it, get a copy of it. When we do our executive medicine physicals, they get a 3-ring binder with everything in it every year. So, I mean, some of these guys got 5, 6, 7, 8 of them up on the shelf. And they can go back and compare. And they bring it in. I mean, the best ones bring it in and say, okay, I got mine from last year. Let's look at this year and compare it to what we had last year and see where it's at. And we can show them on those metrics, you didn't age here, you need to change that, we need to do that. And then use the book as a study guide. I mean, there's some worksheets in there. It prompts you to think. There's a 24-page review of systems to make you, go through there that you can fill out and answer those and see if you see something that pops up. And if you do, then you need to follow up on it. Questions? Yes, sir. So one is that VApp test, which is the advanced lipid profile. So if you're a pattern A, you get 1 point. If you're a pattern B, you lose 1 point. Put you on the VO2 max stress test. We get your cardiac age out of that. And so if you're 5 years, you get 1 of 3 points. If you're 5 years younger than your stated, your chronological age, that's 1. If 10 years, 15 years, so you can get +3 there. Or if you're behind, you can get -3. So we do the same thing with the ANS testing. You can get +3 points there, or you can get -3 points there. And then telomeres, you can get your blood test for your telomeres tested, which rates how old you are, tells us how old you are physiologically versus chronologically. And same thing, you can score 3 points positive, 3 points negative. So the optimal score would be a 10. Worst score, -10. And so that kind of brings all that back in and gives you the most objective. You have to remember there's ranges on this. So just like I used Herschel Walker for his body mass index, somebody could be doing just fine with an A1C that's 5.6, which is the upper limit of normal. But you want to know what yours is, because if all of a sudden it comes back 6.2, that's a change. It's gone up. Something's changed. Or did I change my nutrition? I mean, one thing I tried, didn't work, but I tried it, was I added alpha lipoic acid on, which is an insulin sensitizer. My A1C runs about 5.4. Well, it was 5.3 when I started, and it was 5.4 when I finished. It didn't work, so I really probably don't need any alpha lipoic acid. So, I got rid of it, things like that. So we tried to get it boiled down, because that's a question. So we took the time and have come up with that score, that if you get our physical, you'll get that score. Any other questions?
You mentioned artificial sweeteners, and I understand what you said about them stimulating hunger, but what about artificial sweeteners while you're eating?
I think there's a little latitude in that. I mean, one is just don't like them because they're foreign chemicals you're putting in your body, and good, bad, or otherwise. I mean, they have side effects, headaches, and we get a lot of people get them off those things, and we can get rid of a lot of their minor symptomatology type stuff. So, but if you're taking a diet drink in or artificial sweetener with food, you're not tricking the body, so you at least get past that part. So if you've just got to have that Diet Coke a day, if you have it with a meal, it's going to cause less of a problem. And it's all a matter of quantity. I mean, if you're having one soda, that's not a whole lot, but you got to look where you're adding it up. So I mean, you watch the people walking around, they've got the Tic Tacs and gum that's got artificial sweeteners in it, and then they're having a diet soda, and I mean, they're actually getting quite a bit when they add it up, and they're putting Splenda on their oatmeal in the morning or such, so they end up getting quite a bit of it. So it's all quantity. Any other questions?
At the Executive Medicine of Texas location, because of the fact you've got so many different doctors that you're talking to at one given time, endocrinologists, cardiologists, pulmonary, all the different doctors, if you will. From a technology standpoint, what are you guys doing to link so that right hand, left hand knows what's happening with that patient?
We do it old school.
Okay.
There's only 2 primary care doctors, and we're the only one you talk to that you're responsible for. Those other guys, if we send them out, we get that information back and incorporate it. But everything that's done at the physical is supervised by myself or my partner.
You might want to expand on the medical home idea of how important it is to get those results back. Say you need to see a cardiologist and such. I think a lot of people don't understand the medical home and where that's kind of going.
Well, a medical home is part of the push on a couple fronts, and it's more going to have to do with being able to judge and manage disease state management rather than being proactive. So when you go in to see your primary care physician, the way they're pushing that now is that, you know, if you've got the disease, diabetes, hypertension, whatever, is the doctor or the practice ticking off the box and doing this? They got you doing all the things that we know are optimal for managing that disease. But it doesn't go past routine preventative. I mean, it's, you know, go get your mammogram when you're supposed to, go get your colon done, get your PSA. But they don't get any bonus points, so they're not going to do anything of that proactive stuff so much. They're going to be more focused on disease state management once people already have it, because so many of those people are already falling into that class. And you'll hear the term accountable care organizations too, and then NCQA. So there's a whole new bevy of acronyms that are coming through out of the some of the health bill that was coming. Some of it was coming anyway.
So does that mean that at your facility you function as the primary care physician, or you work in conjunction with primary care, you being preventative and them being reactive?
We both. We have some of our clients that choose to do just the annual physical, take that information and go back to their primary care physician and say, hey, I got this done. You know, these were the recommendations. Can I follow up on this? And then some of those recommendations can be, you know, covered by insurance because they're now disease state. And then we have some that utilize us as their primary care physician, and they just come in to see us for, you know, follow-ups routinely. So it varies. We have people from around the country, so it's not realistic. And around the world, they have somebody come in from out of state just to get their cholesterol checked. Well, thank you all for having me. I appreciate it, and I hope you guys learned something. If you have any questions, I'll be around for a little bit in the back. Thank you.